as we talk about myeloproliferative neoplasms, let's talk a little bit about the goals in these diseases as well as the targets. So the myeloproliferative neoplasms, we're going to speak really today about three diseases that are interrelated. They're chronic leukemias. They include essential thrombocythemia, polycythemia vera, and myelofibrosis. And these in aggregate represent about roughly 450,000 patients in the US. I like to tell individuals they're not common diseases, but nor are they rare. You know, they're not an atypical HUS or other diseases that really are quite uncommon. There are plenty of patients out there that unfortunately labor against these diseases. Indeed, I was at a clinic today and saw 10 new patients with MPNs just today alone, ranging today from a 15-year-old with ET to a 91-year-old with polycythemia vera. Now, given they're a very heterogeneous group of diseases, we've given a lot of thought to try to understand, how are the patients afflicted? And indeed, there's a range of ways that they burden the patient that faces them. One, they can have risk of vascular events. They can have risk of thrombosis or bleeding. That's more common in P. vera and ET, but it can happen in myelofibrosis. They can have risk of cytopenias, with anemia being much more common in patients with myelofibrosis. They can have splenomegaly that is predominant in myelofibrosis, but it can be present in ET or PV. They can have difficult disease-associated symptoms in all three of the diseases. We believe these symptoms are tied to the biology of the disease. And they can have risk of progression from early MPN, PV, or ET into myelofibrosis. They can go from myelofibrosis to AML. Indeed, as I visit with patients, as I had this discussion with them today, for most individuals who are diagnosed with an MPN, it is progression which is the greatest risk. Because for most individuals, if they are managed, they would live out their normal lifespan if the disease did not progress. Now, all of these things occur in the setting of a person that brings to the table their age, their comorbidities, their level of fitness, and their own individual wishes and desires as it relates to their healthcare and goals in life.